स्वागत है टारगेट एम्स जोधपुर चैनल में। हम पढ़ेंगे कम्युनिटी हेल्थ नर्सिंग, वेरी इंपॉर्टेंट फॉर नॉर्सेट एग्ज़ाम, प्री एंड मेंस दोनों के लिए। ठीक है, स्टार्ट करते हैं। स्टैंड ऑफ द कॉमनली यूज्ड वैक्सीन, जो हमारे लिए कॉमनली यूज़ आती है वैक्सीन, उनके लिए जो स्टैंड यूज़ किए जाते हैं उसके बारे में बताया गया है। स्ट्रैंड, एस्ट्रेन बोलते हैं इसको, एस्ट्रेंस वैक्सीन, एस्ट्रेंस बीसीजी के लिए डेनिस 1331 स्टैंड WHO रिकमेंडेड OPV या IPV P फर्स्ट, P सेकेंड, P3 स्टैंडर्ड मोनोविलामेंट और ट्राईविलामेंट और बाईविलामेंट। मीजल्स वैक्सीन, इंडोमोनेस्ट्रोन जैग्रब स्टैंड MC स्टेबन स्टैंड मोनोट्रेन स्टैंड। फिर है मम्स वैक्सीन के लिए GERY जेली लायन स्ट्रैंड, और रूबेला वैक्सीन के लिए RA23/3। येलो फीवर वैक्सीन के लिए 17D स्ट्रैंड, और वेरिसेला वैक्सीन के लिए OA स्ट्रैंड। जापान इंसेफेलाइटिस वैक्सीन के लिए नेका यामिना स्टैंड। बिलीजियन P3 स्टैंड SA 1414 यूज इन इंडिया। फिर है स्वैन फ्लाई वैक्सीन किल्ड है, ये जो A7 बोल सकते हैं। सेलिफोनिया 2009। मलेरिया वैक्सीन के लिए SPF66 स्टैंड या लाइस्टिक कॉकस्टिक या PF25 स्टैंड। RTS या ASOT मॉस्किटो ट्रोफाइल वैक्सीन। TY21A कोवैक्सीन। NIV 2020 से लेके 1770 ऐसा कुछ इस कोवैक्सीन के लिए दिया गया है, NIV। फिर है स्पेसिफिक साइड इफ़ेक्ट ऑफ वैक्सीन, जो वैक्सीन होती है स्पेसिफिक साइड इफ़ेक्ट क्या क्या होते हैं वैक्सीन के। तो गोइलन बेरी सिंड्रोम किल्ड इन इन्फ्लुएंजा वैक्सीन एसोसिएटेड पैरालाइसिस OPV साइबिन टॉक्सिक शॉक सिंड्रोम TSS मीजल्स वैक्सीन MMR शॉक DPD। शॉक में क्या आता है, देते हैं DP। शॉक के लिए DPD शॉक करवा देती है DPT। और प्रट्यूसिस वैक्सीन हाइपर सेंसिटिविटी करवाती है हेपेटाइटिस B और मेनिंजोकोक्केलोसिस वैक्सीन एंड DPT एंड DTO। जनरलाइज रूल फॉर मल्टीपल वैक्सीनेशन एडमिनिस्ट्रेशन टू लाइव वैक्सीन कैन बी कोज टुगेदर। लाइव वैक्सीन किल्ड वैक्सीन कैन बी given together, multiple vaccine can be given together. कोलेरा वैक्सीन एंड येलो फीवर वैक्सीन कैन नॉट बी गिवन टुगेदर, मतलब साथ में नहीं देनी चाहिए। OPV कौन, कोलेरा और येलो। और मल्टीपल वैक्सीन्स भी नहीं देनी चाहिए, लाइव और किल्ड भी साथ में नहीं देनी चाहिए, और दो लाइव वैक्सीन भी साथ में नहीं देनी चाहिए। ठीक है, फिर OPV इज़ ए लाइव वैक्सीन वेयर सिंगल डोज इज़ नॉट ए suspected for immunization advantage in vaccine। एलुमन नेम है। क्लास है इसकी मिलेनरा साटा। कंपोनेंट है एल्यूमिनियम हाइपोक्साइड एंड एल्यूमिनियम फॉस्फाइड। वैक्सीन है डिप्थीरिया, प्रोटोसिस, निमोकोकस, HPV, एंथेरेसिस, HBV, ट्रिक इंसेफेलाइटिस, मीन C, MF59 ओनली इन वाटर इम्यूनेशन, Quelensis TVN 80, Spain 85, Infusa Seprola Pandemic ASO3, only in water immunization, Squela Twan TVN Twan 80 Alpha Tocopherol Pandemic Infusa AFO3, only in water infusion, Sequenus monotres 80 immunoglobulin B1 pH Pandemic Infusa Virosomus Lipospomus Phospholipid cholesterol Cyanosis infusa IAV ASO4 alum adrobed LTR4 agent alumine hydroxide MbL HBV RC529 alpha adrobed TLR4 agent aluminum hydroxide synthesis MPL HBV live attended vaccines are prepared from repressed phases of organism is in tissue culture or kick employs attenuation impulse reduce pathogenicity virus method maintenance antigenicity immunogenicity inactive killed vaccine organism killed by heat or chemical situate active immunity when introduced in body safe but less effective than live vaccine usually administered by intramuscular or subcutaneous route toxic produced by the organism are deoxyribonucleic and used for vaccination preparation highly effective and safe. Cellular fractionation vaccine are prepared from extended cellular fraction recombinant or mixed vaccine more than one killed of immunization agent in use or vaccination live adjuvant vaccine BCG OPV Sabin oral polio vaccine मीजल्स वैक्सीन मम्स वैक्सीन और रूबेला किल्ड में परट्यूसिस आईपीवी साल्क SAL के साल्क इनएक्टिवेट पोलियो वैक्सीन इनएक्टिवेट रेबीज वैक्सीन कोलेरा मेंजिगो कोलेसी वैक्सीन VVM is a marker of the potentious VVM is a simple tool which enable vaccinator to canoize vaccine protection it time of administer VVM is a albel containing a heat sensitive maternal which is placed on vaccine viral to register cumulative heat exposure over time. VVM indicator effective of cold chain temperature maintain. VVM is a mark on opioid viral consist of in outer circular in inner sequence made of heat sensitive maternal WHO guidelines of VVM in OPV based on the color changes VVM only inner sequence changes color circular whole Y remain blue based on VVM OPV is unsafe up to grade 2 grade 3 and grade 4 is discard point characteristics ये क्या है सर्वाइकल या केरस्वेकल Indian first endogenously developed vaccine to prevent cancer cervical cancer expected cost 200 से 400 है short effective कैरेलियल will be effective agent in list for variants of HPV 16, 18, 6, 9 dose to dose remaining 6 months apart, 9 to 40 year age group 3 dose remain 0, 1 to 6 month, 15 to 26 year age group में manufacture serum institution of India Covaxin BB152 type of vaccine whole vibrio inactivate SARS CoV-2 vaccine manufactured by Bharat Biotech BSL3 facilities ICMR and IV 100% indigestive vaccine of India stand NIV 202770 stand 6 mcg per 0.5 ml dose vaccine excipient inactivate corona vaccine albumin hydroxide gel TLR 7/8 angiosis to oxythilone phosphide buffer line protective effective 86 to 96% Covishield vaccine AZD 1222 type of vaccine Covaxin CoA into 1 NCO COVID-19 corona vaccine recommended monovalent vaccine single recommended replication defect chimpandean adenovirus vector encoding then 5 glycoprotein of SARS-CoV-2 produced by genetically modified human embryonic kidney 293 cells mechanism of action following administer the as glycoprotein of SARS CoV-2 is expected locally stimulating neutralizing antibodies and cellular immunoresponse Corvax type of vaccine Indian first indigenally developed RBD receptor binding domain protein subunit vaccine age group recommended 12 to 14 year children as a precaution dose after 6 months of primary immunization with Covaxin. Covishield has 2 dose 0.5 ml each for week apart. Intramuscular cold chain temperature +2 +8 degrees Celsius manufactured biological elapsed in Covax BBV 125 type of vaccine CHAD 36 SARS COVID-19 Chemvindius adenovirus vector recommendation nasal vaccine mechanism recommended replication defect adenovirus vector vaccine vaccine with a pre-perfusion stabilized spike protein Indian first intranasal COVID vaccine age group is more than 18 year dose 2 dose for primary immunization cold chain temperature +2 to +6 +2 to +8 degrees Celsius manufacturation Bharat Biotech cold chain. It is a system of the storage and administration of vaccine from from the point of the manufacture rate to the point of the administer accurate actual vaccine site cold chain temperature of vaccine available in India. OPV sabin routine storage plus 2 degrees से plus 8 सेल्सियस डिग्री लॉन्ग टर्म स्टोरेज 15 - से 25 येलो फीवर वैक्सीन -32 5 degrees Celsius. All other vaccine +2 से +8 also can is cold chain temperature of the vaccine in India. Diuretics can be storage in +2 to +8 or can be kept outside cold chain at room temperature. Vitamin A is storage outside cold chain is room temperature. Health and disease. Health stage of the complete physical, social, well-being defined as WHO epidemiology trend components of agent, host or environment. Extermination of origin. Extermination of origins is eradication. Missing case of a disease are detected by census surveillance. Routine surveillance is supplemented by census surveillance. Watching with attention and auditory suspicion surveillance. Lovier-Toweler disease. Lovier-Toweler disease is largest hospital. A child lost his hand and unable to the routine work is called disability. Disease elimination is interruption of transmission from large area. Bhopal gas triage is type of epidemic. Single exposure point source epidemic. Millennium's development goal aim to reduce MMR by 3/4. Limit for registration of birth is 21 days. In India, death has been registered within 21 day. Only disease which is eradicated worldwide, smallpox. In incubation period is defined as from receipt of infection to clinical picture. Infected person harboring infection agent with clinical feature carrier. Cyclical trend is so by measles, rubella and influenza. HDI comprise knowledgeable literacy and means year of the schooling income and low graduate life expectancy at birth. POLI stand for physical quality of life index. POLI line between 0 to 100. General development index in conducted development index as per general inequality. Life expectancy is a type of indicator. Mortality indicator, positive health indicator, best indicator of availability, utilization, effectiveness of health services. IMR, most important health services indicate of a country infant mortality rate. Only Delhi signify one lost year of healthy life. Delhi disability ages life year DALE has been replaced by HELP. Disability free life expectancy is measured by surveillance index. HELP is used by measure health. HELP is help by measure to health by health life expectancy level of prevention following transitional lifestyle for CDA level of prevention primordial level. Disability limitation is a type of tertiary level of prevention. Psychotherapy is level of prevention. Secondary scrutiny of the disease is the prevention of secondary health promotion is health promotion and prevention. Level is primary level. Preventive action take priority to onset of disease. Primary prevention, early diagnosis and treatment are level of prevention. Secondary prevention, HALTS, health disease in incipient stage and prevent complications. Secondary level of prevention, prevention of emergency of risk factor is primordial. Prevention, health education checkup come in under secondary level prevention. Immuno a child for measures in primary level. Specific protection level of prevention that including especially protection primary not performing anatomically, physiologically, psychologically in function impaired. Target group in secondary prevention, individual with stabilized disease. Pasteurization of milk is a type of prevention. Primary prevention to World Health Day celebration of the World Health Day celebration और अप्रैल 7 वर्ल्ड ट्यूबरक्लोसिस डे सेलिब्रेशन और मार्च 24 डेज 24 मार्च को हम सेलिब्रेट करते हैं ट्यूबरक्लोसिस डे. एड्स मनाते हैं 1 दिसंबर को. WHO रिकमेंडेड BMI फॉर एडल्ट. अंडरवेट होगा, क्लासिफिकेशन अंडरवेट होता है तो वो 18 से कम होगी उसकी BMI. 18 से कम 18.50 से कम. नॉर्मल रेंज में 18.50 से लेके 24.99 होती है नॉर्मल एज. ओवरवेट हो जाता है 25 से ज़्यादा होना. प्री ओबियस में 25 से लेके 29 तक. 1 सेकंड थर्ड 3 ओबेज होता है. फर्स्ट में 30 से 34, सेकंड में 35 से 39 और 40 से ज़्यादा थर्ड में. यूनिसेफ एंड गोबी FFR प्रोग्राम. G यानी ग्रोथ मॉनिटरिंग, O यानी ओरल रिहाइड्रेशन, B यानी ब्रेस्ट फीडिंग, I यानी इम्यूनाइजेशन, F यानी फैमिली प्लानिंग, फीमेल एजुकेशन, फूड सप्लीमेंट. डिजीज ड्यू टू केमिकल एजेंट, कोल डस्ट, COAL कोल डस्ट. एंथेरोकोइटिस, उससे क्या होता है एंथ्रोकोइटिस. सिलिका, इससे होता है सिलिकिस. आयरन सिडिरोसिस. एस्बेसिस, इससे होता है एस्बेसिस. कैंसर लंग्स. कैंसर फाइबर्स कॉर्न फाइबर्स, कॉर्न फाइबर से बेगोसिस. ठीक है. कॉटन डस्ट से होता है बेगोसिस. BYSSINOC बेगोसिस. और केन फाइबर से होता है बेगोसिस. तंबाकू से होता है तंबोकोसिस. हाई और गेन डस्ट से होता है फार्मर लंग्स. नेम ऑफ द सेंटर, हिली, ट्रेबल एरिया, प्लेन एरिया. 1 सब सेंटर एक सब सेंटर पे होता है 30 पॉपुलेशन. हिली या ट्रेबल एरिया पे, प्लेन एरिया पे 5000 पॉपुलेशन. प्राइमरी हेल्थ सेंटर पे 20,000 हिली या ट्रेबल और प्लेन पे 30,000 20 से 30,000. और प्राइमरी कम्युनिटी हेल्थ सेंटर पे 80 से 1 लाख पॉपुलेशन, 1,20,000 पॉपुलेशन. ट्राइकोमा इज ए contagious and affected the conjunctive of the eye, cornea and eyelid. It is caused by the Calamidis trachomatis bacteria. Gonorrhea is a sexually transmitted infection caused by bacteria. Neisseria gonorrhoeae. Measles caused by rubeola virus. Amoebiasis is caused by intramoebus histolytica. Glucose is a Aedes in ORS solution because it increases the solution of absorption. A freshly prepared ONS solution, oral rehydration solution, should be used within 24 hours during cholera outbreak. The best emergency situation measure to be adopted will be provide of chlorinated water. Most common cause of the blindness in India, cataract 62%, followed by refractive error 20%. Midday meal program was introduced in 1961 to improve the school health attention by providing supplementary food. The objective of the midday meal program it is to provide half of the daily requirement for protein, one third of the recommended corollary. The method of the waste disposal, in which waste is disposed along with the night soil is is a composition. The agent trier the Asian trier mosquito, the Asian tiger. The Asian tiger mosquito, Aedes albopicturus, is a small black and white mosquito. Zinc, zinc, phosphoid is in if affected retinocide. Retinocide include rat, mice, sequentially behind etc. Eating maza along leading to plagra. Eating maza means along leading to the pellagra because maza is a poor source of the niacin and tryptophan. Integrative approach is a family therapy approach the focus on the both the biological and psychological comes problem in hand of cotton fiber dust over the long period of the time result in bicyanosis. Monday fever is the other name of the bicyanosis. Bicyanosis, the most common the most common satisfactory method of the waste disposal when suitable LED is available is control triple. A method used for individual health education in communities, counseling and interview. Dulu Dolutegravir is new drug added in ARD regimen for post-exposure prophylaxis for HIV infection. The dosage of the drugs in 50 mg Horcos apparatus is used to detect the estimation of cholerian demand in water. Father of the homeopathy, Samuel Handimus. Koch phenomena is used in tuberculosis. Secondary attack rate in number of the exposure person developing in the disease with win range of the incubation period following the primary cause. The stand which is used to BCG is DANISS DAN 1331 stand. OPV सिबिन OPV यानी oral polio vaccine साइबिन बोलते हैं इसको SABIN. साबिन वैक्सीन इज एसोसिएटेड विथ ए रेयर साइड इफेक्ट ऑफ वैक्सीन एसोसिएटेड paralytic polio or vaccine deliver polio vaccine, cholera vaccine and yellow fever vaccine should be not be together. Most widely used test for diagnosis of rubella germ measures in एगुलेशन inhalation test. टीवी मिशन 2020 was launched it 28 October 2024 by Ministry of Health and Family Welfare. The major objective of the mission is the eliminated TB from India by 2002. National Drawing Day 10 फरवरी. Classical dengue fever is associated also called is breakdown fever. Bubonic plague is the most common type of plagia. The causative agent of escape type P is rickettsitis. Stunting height for age is less than 2 st of the WHO child growth standing medicine. Wasting weight for the health less than -2 sd of the WHO child growth for height is more than +2 sd. The blood pressure is the single most usefully test for identify individual at the high risk of the development coronary artery disease. So S new storm appear in the lungs field of the chest. X-ray in the characterized feature of the silico keratomitis or liquefaction of the corona. Corona is a grave medical emergency. The cornea may become soft and may burst open repeatedly if the eye collapse. Visual loss. Congenitis exposure. Congenitis exosis is the first clinical sign of the vitamin A deficiency. Poliomyelitis is characterized feature of the races in chickenpox and all stages of races. Palpius vesitis crepis may be situated at only time in the same area. Mumps infection is the type. First trimester of pregnancy is associated with the 25 incidence of the spontaneous abortion. The laboratory confirmation of the mumps is a positive mumps IM antibodies. Avian influenza refers to the larger group of different influenza virus that primarily affected birds. Proximal cough is a characterized clinical feature of the Bordetellus pertussis. A severely malnourished child is high risk of the development and dying from pneumonia. If a client has burn injury, avoid prolonged cooling with water because it may lead to hypothermia. Bitoid spot in younger children usually indicate vitamin A deficiency. In excessive intake of retinol causes nausea, vomiting, anorexia, and sleeping disorder, followed by skin discommission, and then in enlarged liver and palpitatory edema. Niacin or nicotinic acid is initially for metabolism of carbohydrate, fat, and vitamin necessary for this, essentially for body, including formation of the hemoglobin, brain development and function, regulation of the body temperature, muscles activity, and कैटाक्लोरामाइन मेटाबॉलिज्म. ये अपनी CHN ख़त्म हो गई. थैंक यू सो मच.